We are currently experiencing a worldwide pandemic. Coronavirus is highly contagious and causes an illness called COVID-19. Symptoms include dry cough, high temperature, and shortness of breath. Older people and people with underlying health conditions are at risk of serious effects. Protect yourself and others by washing your hands regularly for 20 seconds and using hand sanitizer if soap and water are not available. Use a tissue to cough or sneeze into, then throw it away and wash your hands. Clean your phone, avoid handshakes, and avoid close contact with others. By taking these simple measures, you can help save lives. Humanity first, serving mankind.
China is urging its citizens not to travel abroad as it struggles to contain the virus that has now killed more than 100 people.
Now is the time for everyone to stop non-essential contact with others and to stop all unnecessary travel.
A new hotline which can help people understand things like the symptoms, worries about finance. It's been set up by Humanity First UK. And that advice line is open between 8 in the morning and 8 at night. And the number is 0333 880 6619. That's 0333 880 6619.
Yep. Assalamu alaikum. Good evening and welcome to Humanity First UK's first medical webinar. My name is Dr Hammad Khan and I'm the Medical Director for Humanity First UK. We hope to bring you a series of webinars in the coming months on a variety of health and well-being topics. And if you want to ask questions during today's webinar, please post them on Twitter, Facebook, or YouTube. Today's webinar is called Diabetes, Fasting, and COVID. And it's my pleasure to be joined today by Dr Kamrudeen Mohammed. Dr Kamrudeen Mohammed is a consultant in internal medicine, diabetes, and endocrinology at Hull University Teaching Hospitals. He's an honorary senior lecturer at Hull and York Medical School and the training program director in diabetes and endocrinology for Health Education England East Yorkshire. And he's the clinical lead for adult obesity services. He's had first-hand experience in dealing in patients with COVID-19 as he's been working on the medical wards with these patients for the past few weeks. Dr. Kamrudeen, thank you for joining us today and assalamu alaikum.
Walaikum assalam. Thank you very much for this opportunity. Excited to share views on my experiences and of course to share some aspects of knowledge regarding COVID-19, diabetes and fasting.
So Dr. Kamrudeen, it's a difficult time for people at the moment. There's a lot going on. There's obviously worries about the disease. There are people who are suffering with it at the moment, some more severely, some less so. And obviously everything that's going on takes a toll, both physical and mental as well. One of the things is that it doesn't help having misinformation about COVID-19 out there, and there are lots of myths going around. So can you address some of that first of all? What are the sort of common myths related to COVID-19?
There's a whole lecture by itself, but I'll summarize the top myths that we have seen if we go on the WHO website. Some of the common myths are that ingesting a particular type of meal or additives to your meals can be protective, And of course, if you have the infection, it is thought that this can mitigate the severity of the infection. This is completely untrue. There are no established medications so far. There are no licensed medications. Addition of spices to your foods and specific meals do not in any way confer protection against contracting the virus, nor alter the course of the virus. It's really important that persons, whether with diabetes or without diabetes, do not ingest potentially toxic substances, whether it's bleach, detergents, etc., as these can be harmful and do not affect the course of the illness. External factors, for example, extremes of cold, extremes of temperature, whether it's cold or warmth, do not again affect the course of the disease. 5G waves, it is established that viruses usually do not travel along waves, so there's no convincing evidence of this. And in fact, the World Health Organization has documented the presence of COVID-19 infection in countries where there's no 5G network. So it's a real disease. We've been seeing this for the past few weeks. It's a real disease with real consequences potentially in patients, and people should take it quite seriously. Ingestion of excessive amounts of garlic, for example, may have medicinal properties, but it certainly wouldn't help you with a COVID infection. And you may, however, see a side effect of ingestion of high amounts of garlic. People may, of course, be very meticulous in observing social distancing from you because of the body odor. Otherwise, no other benefit.
So that's really interesting. And obviously, as we said, it's really important that we sort of bust these myths and make sure that we have a true understanding of what's happening with coronavirus. One of the things that's out there in the news at the moment, and we've heard it, we've seen that there is concerns that the effects of COVID-19 on people from Black and minority ethnic backgrounds is greater. We've seen that hospital workers from those backgrounds have unfortunately died in greater numbers. Why do you think that might be, and what advice would you give people who are watching?
Okay. No one knows the exact reason, but there are several plausible explanations which have been offered so far. There is incontrovertible data supporting higher, more severe disease in members of the Black and minority ethnic groups. And the first is that, of course, of socioeconomic association. It is well established in the UK that there's a higher prevalence of the Black and minority ethnic group in this lower socioeconomic strata. And it's also well established that the lower socioeconomic strata, there's a higher prevalence of infections. Secondly, there are cultural issues. People of the Black and minority ethnic groups usually live in extended families. And this poses significant practical problems to social distancing and isolation, and may facilitate faster spread of the infection. Taking that into consideration as well, there are well documented higher prevalence of medical problems in the Black and minority ethnic groups, which includes, for example, diabetes, hypertension, ischemic heart disease, which are well-known factors, risk factors for the disease. And lastly, occupational reasons. People of the Black and minority ethnic groups usually have more people facing occupation, whether it be in the transport industry or food industry. And of course, this poses an increased risk of infections. So these are some of the reasons which have been put forward to try to explain the clear data of increased prevalence of infection and severity of the infection in the Black and minority ethnic groups.
And what do you think that people from those backgrounds can do to better protect themselves?
Yeah. There was a fantastic trailer leading into the program of the importance of the public health measures. This goes, there is no specific measure that is required other than to say you should have a risk assessment if you're at work, and there are standardized ways of assessing the risk, but meticulous hand hygiene, social distancing, all these public health measures which are well publicized should be meticulously observed. These are the measures that should take place.
Fantastic. Thank you very much for that. And Dr. Kamrudeen, your area of specialty is diabetes. And we've heard a lot about diabetes in relation to COVID-19. And would you say that people with diabetes are at greater risk of getting COVID-19 infection?
So that's a really important question. Um, we should reassure all persons with diabetes that they are not at increased risk of acquiring the COVID-19 infection. They're not at increased risk. However, if they acquire the infection, then persons with diabetes can experience more severe disease and there could be complications. This may be related with the well-documented fact that persons with diabetes have more difficulties in fighting off infections due to problems with the immune system. What is not known, however, is a breakdown of this information. For example, is it worse in persons with type 1 diabetes versus type 2 diabetes? Is it worse in diet-controlled diabetes versus medication-treated? Shorter duration of diabetes, longer duration of diabetes? This bit of the data is not known. What we do know, however, is that persons with diabetes do not fall into the category of the very high risk vulnerable groups who require themselves to shield themselves for 12 weeks. They do not fall into that category. So in summary, no higher risk of the infection, but if you do acquire the infection, there's the potential for more severe disease.
And are their symptoms likely to be any different, people with diabetes, if they were to catch COVID-19?
No. The symptoms are exactly the same as highlighted before: fever, malaise, dry cough, common symptoms.
Yeah. And any special precautions that people with diabetes should take?
Persons with diabetes, again, should observe all the standard public health measures. No specific measures are required if you have diabetes at all.
And during this period of lockdown, obviously this is happening across the world, happening here in the UK as well. Do you expect to see any changes in people with diabetes and their ability to sort of get good control of their diabetes?
Persons with diabetes who, in the pre-COVID period of time, who have stable diabetes control, may notice that during the lockdown period, there was a rise in blood glucose values, and this most likely can be attributable to a decrease in physical activity. They should therefore test the blood glucose values more regularly to determine if there's a persistent rise. If persons with diabetes do not normally test their blood glucose values, they should remain vigilant for the symptoms of high blood glucose control, which are well known to the public, including thirst, passing excessive amounts of urine, blurred vision, etc. And of course, if these develop, access healthcare. It's really important to try to get in the appropriate number of steps which are appropriate for each person with diabetes, so that this can help mitigate the rise in blood glucose values.
And do you have any special advice for people with diabetes during the lockdown period? Anything in particular that you think they ought to do?
Yes, there are a couple of things I think we should discuss. The first is that every person with diabetes during the lockdown period, and of course even after the lockdown period, which may be lifted to some extent soon, they should have a plan. And the elements of the plan are: first, they should have an adequate supply of medications. I'll come to that a bit later. And of course, testing equipment. That's the first bit. Adequate supply of medications and testing equipment. The second bit is that they should have to hand the reliable contact details for their specialist teams or their healthcare providers. And the third, of course, is to have reliable contact details for any close family members or friends who are able to help. So these are some general points. In addition, this is a really important matter that I want to mention. Persons with diabetes should not ignore symptoms, serious symptoms. Because of the restrictions that we're under, persons with diabetes may develop symptoms and be reluctant to access healthcare because it means coming out of the house, etc. So they should not be at home harboring really important symptoms. For example, chest pain. If they develop chest pain, normally they will access healthcare. So each person with diabetes should ask themselves this question, that if I was not in the lockdown period and I developed this particular symptom, would I access healthcare? And if you would, then you should. A crucial area is, of course, foot care, and persons with diabetes should pay specific attention to their feet, and at the early sign, if there's an infection or break in the skin, they should seek medical attention. Continue to check their feet daily, and of course, be reassured that the standard kidney function tests and eye screening, this will resume in due course. So it's really important that they access healthcare appropriately and not sit at home with serious medical conditions, being reluctant to come out of the home.
Thank you, Dr. Kamrudeen. Just a reminder for people who are watching at home that you are watching and listening to Humanity First's first medical webinar, and today's webinar is on the topic of COVID-19, fasting, and other health issues. And if you have questions that you would like to ask Dr. Kamrudeen, then please post them on YouTube or Twitter, and we'll pick them up and we'll ask those questions to Dr. Kamrudeen. Dr. Kamrudeen, if we can move the conversation on now. We talked about the risk factors for people with diabetes for getting COVID-19, the measures that they should take during the lockdown period. If, unfortunately, someone with diabetes catches COVID-19, what then? Are they going to have more trouble with their blood sugar levels? Are they going to have any other challenges that they have to face? What are the sort of things that they need to look out for?
A really important question. All persons with diabetes should be aware of the terminology that we use of sick day rules. These are specific actions that they should take for if they develop any sort of illness. And the key elements of the sick day rules are that if you're testing blood glucose values, then you should test more often, even if you're not eating as regularly as before because you are ill. Blood glucose values will rise because of the response of the body, the hormonal response of your body fighting an infection. And therefore, you should test regularly blood glucose values. Secondly, especially for persons with type 1 diabetes, you should be testing, testing for blood ketone values to make sure that diabetic ketoacidosis does not develop. Thirdly, it's important to remain hydrated, and if you're in doubt, sip at least 100 mils of fluid per hour. If a person with type 1 diabetes cannot ingest food, they should of course make that up with rapid-acting carbohydrate taken as liquid. If low blood glucose values develop, which could happen, then of course hypoglycemia can be treated with 15 grams of rapid-acting carbohydrate and then recheck blood glucose values 15 minutes later. So it's really important as well that persons with diabetes, when they have become ill, should understand when they need to seek healthcare. So, for example, if they're not sure what to do, if there's persistently high blood glucose values despite changes to the medications, for example, increasing the dose of insulin does not reduce the blood glucose values and it remains high over 24 hours, seek assistance. If it's a persistent presence of ketones in the bloodstream, they should seek assistance. So bottom line, follow sick day rules and understand when you should seek help from the healthcare provider.
And is there anything in particular that people with diabetes should do in terms of their supply of medications? You mentioned the fact that they should ensure that they've got their blood sugar strips available. Anything that they need to ensure for their supply of medication in case there are problems?
Yeah, this is a really important area. Persons with diabetes should be reassured that there's no need to stockpile medications. They should have an adequate supply, but there's no need to stockpile medications because we've been reassured by the national bodies that there's an adequate supply of tablets and injectable treatments, including insulin. However, a word of caution, do not leave the repeat prescriptions too late. Get them about 2 weeks in advance to ensure regular supply. I want to mention about information on the social media regarding blood pressure medications, which allegedly could have promoted the entry of the virus into cells of the body. There is no evidence that blood pressure medications can do that, and all the international and national societies have agreed that persons with diabetes, or indeed without diabetes, if you're on the blood pressure medications such as an ACE inhibitor, that is, these are medications that end in pril, such as ramipril, lisinopril, you should continue taking it. And the other group of medications, they are called sartans. They end with the term sartans. For example, candesartan, irbesartan. They should continue taking these medications. A word of caution, I want to mention specifically about paracetamol. It's a safe medication to take for the overwhelming majority of people, and you can use this safely in the COVID infection. There was one caveat, and this relates to persons with type 1 diabetes who are on continuous glucose, some types of continuous glucose monitoring devices. If you take paracetamol regularly in high doses, then this can interfere with the glucose sensing, and you can have incorrect glucose results. So it's important to use finger prick, capillary testing if you're not sure. The last general point I want to make about medications is that there was some theoretical concerns regarding ibuprofen and of course the risk of the infection. It's agreed that it's a safe medication. However, in persons with diabetes, I personally and the majority of diabetologists would not use this regularly or routinely as a first-line treatment for symptoms because of potential side effects, especially on the kidneys. So these are some general points regarding medications.
Any other specific pieces of advice in regards to medication during the illness with COVID-19?
There are some important bits that we should mention. The first is regarding, so if a person with diabetes develops the COVID infection, or indeed any other infection for that matter, then there are some changes to medications which are really important. And the first is that if you are taking metformin, then you should suspend taking metformin for the duration of the illness. This is to reduce the potential for formation of acids in the bloodstream. It's otherwise a very safe medication. Secondly, there are a newer group of really important medications for diabetes called the gliflozins. So patients with diabetes may recognize the names such as Forxiga, Invokana, Jardiance. These are highly effective medications for heart disease in diabetes, heart failure, and kidney disease. However, if you develop an infection, including the COVID-19 infection, then you should cease taking these medications and only restart them when you're better, to reduce the risk of developing acids in the bloodstream as well. Furthermore, there is a risk of developing low blood glucose values, of course, with medications such as gliclazide, which can lower blood glucose values, and insulin therapy. So monitor very closely, and if the blood glucose rise, be prepared to increase the insulin doses, and if you're unsure, seek help. One last note I want to say, specifically for persons with type 1 diabetes, it's imperative, it's really important, that insulin should never ever be discontinued, even during the illness, even if you're not eating. You can become seriously ill. Seek help, follow the sick day rules, and seek appropriate assistance.
Brilliant. That's really, really useful advice, Dr. Kamrudeen. If we move on from COVID-19 now to talk about Ramadan, to talk about fasting. So one question which a lot of people have is that if you have diabetes, if someone has diabetes, are they able to fast? Is it safe for them to fast?
Great question. This question has been addressed in a variety of international guidelines, and as a diabetologist myself, I'll talk you through the thought process if someone comes in my office and asks, can I fast if I have diabetes? So my task is to place the person with diabetes into a particular risk category. And there were 3 risk categories defined by the international societies. The first is what we term the low or moderate risk. Second is high risk. And thirdly, the very high risk. And I'm going to give a couple examples so that it'll become a bit easier, but of course it's not exhaustive. This can be found in the public domain. So who are persons with diabetes who may fall into the low or moderate risk of fasting when you have diabetes? That is risk of complications. So persons whose diabetes is controlled by diet or metformin only, or tablets indeed, which do not themselves cause low blood glucose values, less than 4 millimoles per liter. These persons with diabetes may fast relatively safely. The societies mention that if you're on a once daily injection of insulin, then there is a moderate risk. And my personal view is that if you're on any medication which can cause low blood glucose values, it's really, you have to fast very cautiously, if at all. Now, if a person falls into the high risk group, the general advice is that this person should abstain from fasting. And persons who fall into this group include, for example, all persons with type 1 diabetes, all persons, for example, with type 2 diabetes who are being treated with insulin therapy, either 4 times daily injections or twice daily injections, pregnant ladies, persons with stage 3 up to stage 3 kidney disease, they should abstain from fasting. These are persons on the high risk group. Persons who fall into the very high risk group, of course, are those who, for example, they have developed an episode of severe low blood glucose values that is requiring assistance to correct it in the previous 3 months leading up to Ramadan. If a person with diabetes has been admitted to hospital because of high blood glucose values, for example, with diabetic ketoacidosis, in the 3 months leading up to Ramadan, they should abstain from fasting. Or the persons with type 2 diabetes with that syndrome called hyperosmolar hypoglycemic syndrome with very, very high glucose values, in the 3 months leading up to Ramadan, they should abstain from fasting. Persons, this is a really important category, persons with diabetes who are unaware of the symptoms of low blood glucose values, extremely, very high risk, they should abstain from fasting. And of course, persons who are on dialysis, again, fall into the very high risk group and should abstain from fasting. So this is what we'll do, is to place the person into a risk category. The ideal situation, however, is for each person with, who wants to fast, has diabetes, they should see the health practitioner approximately 8 to 12 weeks before the commencement of fasting, so that appropriate structured education can be delivered, the risk assessment be made, changes to the medication can be made, and optimization of blood glucose control leading into Ramadan can be done as safely as possible.
Brilliant. Dr. Kamrudeen, that's really, really clear. And I think the takeaway for me is that if anyone has diabetes and they're concerned, they have a question about whether they should fast, they really need to go and get advice from their own medical practitioner. So a little bit of advice for people if they have diabetes and they're fasting and they develop symptoms of COVID-19. And these are the symptoms that you've talked about already, the fever, cough, muscle pain. So if they get those symptoms, what should they do?
The simplest answer is they should not fast. If they're fasting, they should break the fast, because we are not sure. We have already mentioned about the variable course of the illness in persons with diabetes. So we have to err on the side of safety. Once the symptoms develop and you're fasting, there's a facility within the faith to break the fast and observe the fast later on if you would like to. But it's really important, because people can become ill quite quickly, and it's important that we be as safe as we could. I'd like to make a general comment regarding fasting, of course, just going back to the previous question. If a person with diabetes is fasting, they should be prepared to test their blood glucose values regularly. And if you've become ill now, you have symptoms with the COVID-19, check the blood glucose regularly. If blood glucose values fall high, rise high, for example, more than 15 or 16 millimoles per liter, you should break the fast. But it's advisable to break the fast. If blood glucose values fall to less than 4, hypoglycemia, they should be prepared to break the fast. And if other symptoms of significant illness develop whilst they're fasting, they should be prepared to break the fast as well.
Thank you very much, Dr. Kamrudeen. Another question which a lot of women have when they're pregnant, really, with diabetes, what should they do? So what's the advice regarding pregnancy services for women with diabetes?
So pregnant ladies with diabetes should be reassured that across the board nationally, despite the change in the way we work, the pregnancy services have continued, and they should continue to access this and be reassured that this service has never been compromised. And that's the summary of the advice. They should continue to access the service. There's been no deficiency, as far as I know, throughout the country in providing care and providing antenatal care.
And I guess that advice goes for all pregnant women, whether they have diabetes or not, because
Yes.
obviously they should all be seeking good antenatal care for their own well-being and the well-being of their child as well. I've got one final question before we move on to questions from our viewers, and that is that for anyone who's caring for someone with diabetes, what are the key things that they should focus on? What are the key things they should be aware of?
So it's really important that the person who is caring for a person with diabetes, they should, of course, observe the public health guidance regarding reducing the risk of infection. However, if you have to administer insulin therapy, for example, to others, attend meticulously to hand hygiene. If you're in charge of the overall care, of course, we have mentioned before of ensuring that you have a regular testing equipment, regular supply of medications, and also regular supply of glucose so that you can correct hypoglycemia. So again, you should also have a plan for all situations where there's high blood glucose values, low blood glucose values, or adequate supply of medications, and of course have contact details for the healthcare professionals to hand. Other than that, no other specific recommendations really.
Fantastic. Thank you very much. I'm going to move on to questions from viewers. So we've got lots of people watching and a number of different questions. So first question, just moving back to a point that you made about ketone levels. And Farah Ahmed has asked, what level of ketones for people with type 1 diabetes should be a cause for concern and should be a reason to seek immediate medical advice?
Okay. So there are two ways of measuring ketones. One is in urine, which is less reliable than the blood. So traditionally in the UK, we are now almost exclusively using blood ketones. So if your blood ketone values are greater than 3, then you should seek assistance. If it's less than 1, then you have time. And between 1 and 3, there's a standard bit of advice, which is a bit too complicated to go through via this without a diagram, but can be accessed if you Google trend and diabetic ketoacidosis. You'll get an appropriate leaflet to give you a flow chart of what you should do. But these are the rough ballpark figures of managing ketones in persons with type 1 diabetes. I'm conscious it's a talk for a general audience, so I haven't brought any slides to show complex flowcharts, etc. But hopefully these numbers will reassure the questioner.
And as you said, the information is also available out there. If people look, there is online information available for people with diabetes.
Yeah, sick day rules. If they're not sure, sick day rules, type 1 diabetes, and in a variety of societies will have well documented care pathways.
Brilliant. And Alina Ahmed asked a question. I think we've answered this question, but it's worth reiterating that if you catch COVID-19 you're fasting, should you break your fast? And you were clear about this.
I think we should. I think the advice is that you should, because we are not sure of the course of the illness. And it's important that you focus on the severity of the symptoms. And of course, if you're fasting, you can have a variety of symptoms, which can probably overlap. So it's really, really important to be clear and safe.
Great. And another question, an interesting question. Someone has written and said that there was research that was being done on metformin potentially being effective against coronavirus. And do you know anything about this? Anything that potentially could be useful with metformin as a treatment?
No, the latest review from last week, Lancet and Diabetes and Endocrinology, there is no support for metformin in mitigating the effects, either the risk of infection or altering the course of the infection. There is a potential for one anti-diabetic medication that is called the gliptins. There's a theoretical potential for a mechanism, but that's unproven as well. So currently, there's nothing which has been proven.
But people shouldn't stop metformin if they're taking it and they get symptoms.
If they do get symptoms, if you're ill in any illness, then metformin should be suspended. You shouldn't take it during the course of the illness. You should restart it after whatever illness passes, whether it's diarrhea and vomiting, etc.
So that's clear. It sounds like a very specific question, but I'm going to ask it anyway because it may be there's some general advice here. Tayyib Yaqub has asked the question that if you have someone who has gangrene, which is obviously one of the complications of diabetes, and that person is reluctant about doing anything about it, then what advice can you give? What is the, as a diabetologist, you must come across this quite a lot.
Okay, so I'm going to assume that we're talking about gangrene is going to be gangrene of the lower limb because this is more common than gangrene of the upper limb in persons with diabetes. So two different types of gangrene, but the bottom line is this person should seek medical attention because the gangrene indicates a compromise, a reduction, a problem with the circulation to the lower limb. And this can become worse, and there are potential treatments for this. The other aspect of it is that the gangrene can, of course, become infected and can rapidly ascend and, of course, compromise health. So it's a lot of tact that is required to get that person to see an appropriate healthcare practitioner so that this gangrene can be evaluated and we can intervene. But it's a really important condition.
And potentially dangerous. So definitely
very dangerous.
Yeah.
Potentially dangerous consequences. Can I say one thing on a topic? Would that be okay?
Of course.
I just wanted to mention an often neglected area, which is mental health in general, and of course mental health in persons with diabetes. I just want to say a couple of things about this because outside the COVID era, which is well established that 4 in every 10 persons with diabetes would have diabetes distress symptoms. And then we add COVID on top of this. Could you imagine what potential impact it could be on someone's mental health? So it is crucial that we invest into optimizing the mental health of persons with diabetes. And there's some simple practical things, which I'll just mention very quickly. And again, these are accessible in the public domain. We are social animals, and it's important to stay in contact with others. And I don't need to tell this particular audience of the various methods of staying in contact. Physical activity is important, which can affect your mental health. Of course, mental activity is important rather than passive activity. Learn a new skill, mindfulness, spirituality, or prayer if you're that inclined, whatever your religious persuasion. And the last, but probably one of the most powerful ways of investing into our mental health is giving to others. Whether it be a phone call, helping the neighbor with the shopping, or donating food to a food bank, for example. These are powerful mechanisms to optimize mental health in this, this difficult period. Over to you, back to you, Hammad.
Thank you very much for that, Dr. Kamrudeen. So more questions for people who are watching. So some people are worried that during the month of Ramadan, because they're fasting, they may not be getting the right nutrition. So should they take supplements? Is there anything in particular that they should be taking during the month of Ramadan to make up for that?
Okay. So if a person comes into Ramadan with a good quality of health, there is no need for supplementation. In fact, what we can do is to optimize the meals. We should have more healthier choices at Sehri, but particularly at Iftar and your later snacks if you're having it. Choose healthy options, and this will be enough. There is no need for specific health supplements at all during this month.
And I should have mentioned that question was from Sheriar Sheikh. So your specific advice to him and anyone else that's worried is that your meals, whenever you're taking them, they should be healthy. And if you take healthy food, then you should be covered and you'll get the right nutrition.
Yes.
So move on, and a question which has come from Alina Ahmed: which people are more at risk of catching coronavirus? And I guess this is something that people really worry about a lot. That are there groups of people who are at more risk of catching coronavirus?
There are certain groups which I'll go through. These are the high-risk vulnerable groups which fall into this 12-week shielding period. And roughly, these are persons who, for example, would have had transplant therapy, would have undergone radiotherapy, would have had severe lung disease, for example, severe chronic obstructive pulmonary disease or cystic fibrosis, people on high-dose steroid therapy. So the immune system is likely to be compromised, and these persons are deemed to be at very high risk and vulnerable, hence the government recommendations for the 12-week isolation.
And the risk for those individuals is that if they catch COVID-19, they can have a much more severe illness and are more likely to become more unwell.
That's absolutely right. Absolutely right.
A question from Nasir Shams, and it's related to fasting and diabetes. So can the odd timings of fasting meals affect my sugar levels? So because we have a long gap and then you eat at the beginning and the end of the day, can it affect your sugar levels?
Okay, so I'm going to assume now for the question that the person has diabetes, and if that's the case, then the blood glucose values are going to depend on three things. One is, of course, the food intake. Secondly, that prolonged 16, 17 hours without food. And thirdly, physical activity. So these are the primary determinants of the blood glucose values. So to answer the question now, it depends on the types of food and the amount of food that is eaten. So for example, if a person with diabetes takes a very light sehri, early morning meal, depending on if you're taking medications which can lower blood glucose values during the day, blood sugar values can fall. If when you have the iftar, you have a very large meal with high calorie foods, then you can become pretty unwell because blood glucose values can spike very high. So it's important that persons with diabetes who are fasting, who fall into the low to moderate risk and you're fasting, be moderate in everything. Avoid very high calorie foods, very high fatty foods, and eat as balanced a diet as you could. And this is the best way to invest in reasonable control of blood glucose throughout the day and night.
And Farah Ahmed has a very specific question about ketones in children with diabetes and what levels should you be worried about?
Okay, so I'm not a pediatrician, so I'm just going to be a bit guarded in the advice. I'm going to say that the same numbers apply. So ketone values above 3 is a significant concern and should be seeking assistance or following the sick day rules. You can be relatively reassured if the blood ketone values are less than 1. Between 1 and 2, there are some specific sick day rules that you should follow with increasing insulin doses depending on your total daily dose of insulin, etc., which are found in the in the flowcharts which are available in the public domain. But these are the rough numbers that should provide a ballpark figure for interpreting.
Thank you. And as a pediatrician, I can confirm that that's correct. Normally, ketone level less than 1 is okay. Between 1 and 2 normally requires some more insulin, and more than 3 will require some seeking medical advice and some more insulin. But obviously, as you said, people will have sick day rules. They will have from their clinicians, the people that are looking after them, and they should look at those and they should follow the advice given by their clinicians for those sorts of very specific questions.
Yes.
People, again, worried about risk factors, and are people with asthma more at risk of of COVID-19?
Mild, well-controlled asthma, no specific risk. However, difficult to control asthma requiring oral steroid therapy, this falls into higher risk, and if the person is working, they should have a risk assessment with their employer. So there's, of course, as we know, in most diseases, there's a range of severity. And if you fall into the more severe range requiring multiple different types of steps in the therapy, but oral steroid therapy, that places you at higher risk, and you should have a risk assessment if you're working, or take specific precautions if you're not.
Brilliant. And I think we're coming up to the last of our questions now. And one question from Muzaffar Ahmed. For someone who's had cancer and undergone chemotherapy within the last 5 years, do they fall into the extremely vulnerable category?
The 5-year, they need a risk assessment, but if they are not in any other immune modulating therapy at the moment, the risk, they do not fall into that very high vulnerable risk group. So it all depends on what's after that. If you've had one discrete episode of treatment and then you're back to stable health, then you may not fall into that very high risk vulnerable group.
Thank you, Dr. Kamrudeen. And unfortunately, we've come to the end of our time for today's webinar. And just a reminder for people who are watching that Humanity First has a special COVID helpline, and that is available for any members of the public who require general advice, not medical advice, general advice, help with shopping, medicines drop-off, or just for a chat. And if you go to hfuk.org or look at our social media sites, Humanity First UK, then you'll find information about our COVID helpline. So that is available for people to seek general advice about COVID. And I'd just like to end by thanking Dr. Kamrudeen Mohammed very much for coming today and giving his amazing advice on coronavirus, diabetes, fasting. We've covered a huge amount of ground today, and I'm very, very grateful for him for coming on today and answering all of my questions and all the questions of the people that have been watching. Thank you, Dr. Kamrudeen.
Thank you very much for the opportunity. I just want to say thanks a lot to Humanity First for hosting me, and I'm deeply grateful for the opportunity.
Thank you, Dr. Kamrudeen, and thank you to everyone that's been watching today's webinar. And hopefully you'll be able to join us again soon for our next medical webinar. Keep an eye on our social media feeds on Twitter at Humanity First UK, and you can find us on Facebook as well. So keep an eye on those and get information about our next webinar. And you can also donate to Humanity First at hfuk.org. Thank you very much for joining us today.
Thank you.
China is urging its citizens not to travel abroad as it struggles to contain the virus that has now killed more than 100 people.
Now is the time for everyone to stop non-essential contact with others and to stop all unnecessary travel.
A new hotline which can help people understand things like the symptoms, worries about finance. It's been set up by Humanity First UK, and that advice line is open between 8 in the morning and 8 at night, and the number is 0333 880 6619. That's 0333 880 6619.
Four, 55.
Thank you to Humanity First and International Health Partners for donating the surgical scrubs to Airedale NHS Foundation Trust. That will help us in this very busy time combating the disease COVID-19.